Okay, welcome back. Chapter 4, Documentation. Today we'll be talking about functions of the pre-hospital care report, collection of data and PCRs, medical abbreviations, legal concerns, and alternative documentation methods. Case study intro. EMT Rory picked up the phone in the Station 4 crew room on the second ring. EMT Bruns, how can I help you? It's Dana, replied the shift supervisor, Dana Hathaway. I'm afraid I have good news. I don't have good news. We were served with a notice of a subpoena for a patient care report on a call you had last summer. I pulled a copy of the patient care report, and I'll bring it by the station. How can the PCR help Rory? What kind of information will the parties involved in the legal case be looking for in the PCR? What are some ways to ensure that all important information about each call is documented? Take a minute, go ahead and pause this video and write these questions down. Try to answer them as we go on with the lesson. Alright, documentation of information about EMS calls serve several purposes. The record of care provided is called a patient care report. Thorough, accurate documentation is critical EMT skill. And one thing I want to say about that is that if you don't document what happened on the call, then it didn't happen. I know it physically happened, but there's no way to testify to it, no way to attest to it, because that particular incident is gone and there's no record of it now. So that's what you'll hear all the time. If it's not in your report, it didn't happen. So that's something to be thinking about. Alright, the functions of the PCR, patient care report, is what PCR stands for. Continuity of medical care. Emergency department personnel will reference the PCR. That means the doctors and possible nurses, the emergency care, the emergency department, the hospital will look at your patient care report, see if there's any details. Administrative issues, billing and insurance reimbursements, statistical information for future planning. Legal document. The patient may be a crime victim, so therefore there's more documentation other than just a police report. And then protection in the event of civil lawsuit. So, if the patient says you committed some kind of negligence or something like that, they can go back and look at the PCR and reference what you said instead of you just giving your testimony. And you see the guy documenting his PCR, and that's what it's going to look like, because most of your ambulance services now have tablets or MDT laptops. Education and research. PCRs can be a rich source of data to allow research on many issues. Continuous quality improvement. CQI is an essential process in all EMS systems. Alright, collection of data in the PCRs. All documentation must be careful and thorough. There are paper and electronic PCRs. I'm going to guarantee that you probably won't do any physical paperwork. If so, it may be a form here or there, but most everything is on computer now. Let's see. And here's an example of a PCR that's on paper. Doesn't really matter where it's from. But you see there are many boxes to fill out, and as you'll see on electronic PCRs, there'll be many boxes to fill out. A tough pad. I know for a fact the ambulance service that I work for, we use iPads, and so it's pretty cool. It's a little aggravating sometimes because if you have big fingers and you're trying to touch a little small drop down or something like that, but you can get your own stylus like they show you here, but for the most part it's pretty simple, and once you understand how to write the PCRs and you get fluid with it, I think within a couple weeks I had it down pretty good. So it comes quick. All right, 2 basic rules of PCRs. If it wasn't written down, it wasn't done. That's what I told you earlier. If it's not in your report, it didn't happen. Okay. If it wasn't done, don't write it down. So if it didn't happen, don't put it in your report. Don't lie. Don't make things up. Don't fabricate stories to make yourself look better, because if you get caught, say goodbye to your career. I don't know why they would have smartphones. Maybe some companies do. I'm not sure, but I haven't seen any. U.S. DOT minimum data set, established by the U.S. Department of Transportation, is a collection of standardized information, allows meaningful comparison and analysis for the improvement of EMS care nationally. All right, patient information of a minimum data set. We want a minimum data set's like the basic minimum amount of data that you're going to get. Chief complaint, level of responsiveness, blood pressure, skin perfusion, skin color, temperature and condition, pulse rate, respiratory rate and effort, patient demographics. Administrative information of the minimum data set. The time the incident was reported, time EMS unit was notified, time of arrival at patient, time unit left the scene, time unit arrived at destination, and the time care was transferred. That's all going to be part of your minimum data set. It's very important information. That's just stuff that, especially this stuff right here, that's going to keep you honest, and it's also going to negate any kind of accusation. If a patient says you took too long doing this and that, the way they track the ambulances now, there's no possible way. You can't even lie, because it's already got your timestamp in the computer whenever you leave and arrive and stuff like that. So, but that is your minimum data set. PCRs usually have these sections: administrative information, patient demographic and other data, vital signs, patient narrative, and treatment. Other sections: administrative information or run data will be the EMS unit number and run or call number, names, certification, level of crews, address of call location. Patient demographic and other data, like patient's name, age, sex, race, birth date, patient's home address, insurance and billing information, location patient was found, and care given before the EMTs arrived. Vital signs: at least 2 sets of vitals are needed. Record the patient's position when the vitals were obtained. Document the time vitals were obtained. I'm telling you right now that you're going to see all of this on your reports. Patient narrative. This is where you're going to write what happened. Information from the physical exam and pertinent scene information. It includes the chief complaint, patient history, and physical exam findings. And you're going to select the proper medical terms and spell them correctly. Please spell it correctly, because you don't want to look like an idiot. Objective information is verifiable or measurable. Subjective information is based on perceptions or opinions. So objective is the facts. This is what it was. There's no getting around it. Subjective information is based on what you perceive and what your opinions are. Basically like your field diagnosis. Pertinent negatives are signs and symptoms that might be expected, which are not found. So maybe if someone was stung by a bee and they are allergic, but you would expect to see hives and itching and shortness of breath, but you don't. So, which would be a good thing, but still, it's a pertinent negative. Treatment. Detail treatment in chronological order. Document the time of each treatment. And document the patient's response to each treatment. Very important information. All right. The use of accurate and synchronized clocks. Dispatch, vehicle, and EMT timekeeping devices must all agree with one another. Needed for accurate documentation of medical care and needed for administrative and legal purposes. And let's see, I'm searching up a term for you. You'll see the word CAD, C-A-D, or the mnemonic CAD, and basically it stands for Computer Aided Dispatch, and it keeps a record of everything. So all those timestamps and everything, whenever you put yourself on scene, whenever you tell dispatch that you are en route to the hospital, whatever hospital you're going to with one patient, it's going to timestamp you. Whenever you tell them you're at the hospital, it's going to timestamp. And then whenever you transfer care, it's going to timestamp. Whenever you make patient contact, I want to keep a record of all that for you. And one of the most beautiful things about CAD is that it will also remember all patient information. So if you've dealt with a patient before and all their information is in the computer, well, then guess what? You can import all that data from CAD and make sure, you can ask the patient, is your address still correct and stuff like that, but it's there. If everything's correct, you just import it. All of those boxes are filled out for you. All right, so we're going to match the description on the left with the type of PCR information listed on the right. Click in each box on the left to check your answers. All right, so number 1, pulse rate. We are going, if you said D, then you would be correct. Oh, it went back. Hold on. Well, that's not cool. Give me 1 second. We're not that close to being done. There it is. All right. Again, I'm just gonna call them out to you. So, number 1, if you said, C, not D, is a vital sign. All right. EMT's names are going to be. Give you a few seconds. If you said A, administrative information, you'd be correct. Patient's chief complaint, headache on right side of the head for 3 hours. Patient complained of headache on the right side of head for 3 hours. Then that's something you're going to add into D, your narrative. 4 LPMO by NC. That is a medication administration, so you're going to put that under E for treatment. 45-year-old male, and that's going to be your B, patient demographics. Okay, let's keep going here. All right, the EMT supervisor Dana has just arrived at Station 4 to talk with Rory about the subpoena. As of yet, Rory has not been subpoenaed, but it is possible that he will be. Subpoenaed means you get called to court. That means the defense attorney or the prosecutor can. That's basically an official request for information or official request for your appearance. It turns out that it is a criminal case in which the patient was a victim of domestic violence. The county attorney is looking for evidence that might support the case. The defense attorney will try to refute any information that can harm his client. So basically, it says the prosecutor or the county attorney is looking for evidence, so they're subpoenaing all these reports and stuff. All right, again, pause the video and write these questions down. What specific elements of the narrative could be important in the prosecution's case? What weaknesses in the documentation will the defense seek to exploit? If Rory is called to testify, what role will the PCR play? All right. Medical abbreviations. Use only universally accepted abbreviations or those approved by your EMS system. You'll be mastering medical terminology and abbreviations your entire career. That is correct. Refer to table 4.1 and 4.2. All right. So I'm not going to read all these to you because I know you can read, but these are some of the abbreviations on the left is what you need to look at, and the explanations on the right, you need to become familiar with these. Charting abbreviation. So on the left, you have the categories, patient information categories. On the right, you have the abbreviations. Again, I'm not going to read every one of them to you, but you can look at them and study them. They're in your textbook as well. Body systems, common complaints on the left, abbreviations on the right. You may see some of this stuff on the test, not necessarily as a test question, but you may see like case studies or something like that, or questions that are worded, but they won't spell out the actual term. They'll abbreviate, like on the right, so you'll have to understand what that means. Diagnoses. So you see a lot of terminology, and these are things you need to open that textbook and take some time and read them. Medications, anatomy and landmarks, physical exam findings, miscellaneous descriptors, one of the things that I was going to show you where it says alert and oriented, we say this a lot, A and O times 4. And now, I'm not saying that you need to have all of this memorized to be an EMT, but this is something you probably need to keep in your back pocket, because you're going to hear a lot of this stuff. During your career, and you'll become more familiar with it and understand what people are talking about, and you'll start using it yourself. Because just like this, it says ACLS, Advanced Cardiac Life Support, so you're not going to be walking around saying they needed Advanced Cardiac Life Support. You're going to be walking around saying they needed ACLS, or the next one, Advanced Life Support. You're not going to say I called for Advanced Life Support. You're going to say I called for ALS, and people are going to understand what that means. So again, some more tables. All right, that is a lot of stuff. So that's, I would encourage you to at least look it over. Let me go back real quick. Orally, see it says PO right there. Definitely use that a lot. So I know at PO, how does that even correlate with orally, but that's what they want. So so just like I said, this little things like that are gonna keep you knowing what's going on. We look up here to intravenous IV. You've had an IV inserted before, you've seen somebody with an IV before, that's intravenous. You'll hear IM for intramuscular IN for intranasal, IV for intravenous, okay, IO for intraosseous. That means they basically drill into the bone to start an IV. So you'll see those. Intracardiac, I don't know if you're going to be doing any intracardiac stuff, but maybe the hospitals. But IM, IN, IO, and IV, definitely. I hear intravenous push, I hear IV push all the time. So, all right, medical abbreviations. 48-year-old man is alert and oriented with a chief complaint of severe chest pain and trouble breathing. He took 2 nitro without relief today. He is prescribed Lasix twice daily. He has no known allergies. And down at the second bullet, you see the abbreviations. 48-year-old male patient, alert and oriented ×3. Complains of chest pains and shortness of breath. Took 2 nitroglycerins. Negative relief. So you see the little negative sign right here. Negative relief. And RX Lasix BID. That means twice daily. No known allergies. I think the only time you're going to be using this stuff like that is if you're writing it down to, take notes for yourself. But you're not putting that in a patient care report narrative because some of the people that are reading these patient care reports have no idea what that is. Okay, so you're going to write it out like this first paragraph right here. All right, legal concerns. Confidentiality. The PCR contains information that is confidential and which cannot be shared with unauthorized individuals. Release of information is governed by HIPAA. Distribution. We talked about HIPAA before, so you should understand what HIPAA is. Distribution. Specific instances in which PCR information can be distributed include to relevant healthcare providers like the emergency department, continuous quality improvement, medical oversight and billing, police when it's needed for an investigation, and upon subpoena. We talked about this, I think it was in Chapter 3. So, just kind of a legal concerns. Refusal of treatment. Legal issues arise when a patient refuses care. Establish patient mental capacity and contact medical direction. Just like we talked about before, your patient has to be able to make rational decisions and be of their right mind before they can refuse. Persuade the patient to accept care and inform the patient of consequences of refusing care. Those last 2 bullets, when you persuade the patient, remember that your company is going to get paid by patient transports to the hospital. So if they legitimately need to go to the hospital, you need to do all you can to persuade them. And if they do not, you need to tell them the consequences of refusing care. Document the following in refusals. If the patient refused any or all assessment and the treatment offered, the patient's mental status in making the decision, and have the patient witness and sign the form. If they refuse to sign the form because they are adamant about refusing all of your help, then you need to put on there refuse to sign and have a witness, like someone who's not a family member, sign that form. Also notify your supervisor. Here's another example of a refusal on paper format. Like I said, most of your stuff's going to be computer based anyway. Falsification of PCR information. Falsification compromises patient care. It can lead to loss of licensure and possibly criminal charges. Mistakes or omissions must be correctly fixed as soon as possible. You see right there down at the bottom, there's a word that was obviously incorrect. The EMT drew one line through it and initialed. That is the standard, oops, I made a mistake, and I'm not trying to cover it up. And when people see that, they'll understand that it was a mistake and you fixed it. Okay? Must initial all errors. Transfer of care is used when it is not possible to complete the full PCR and obtain signatures before leaving the facility. A type of special transfer of care form may be used. Full PCR must still be submitted as soon as possible. Multiple casualty incidents, you'll hear us talk about MCIs. Triage tags can be used to communicate basic patient information. Triage tag has 4 colors: black, red, green, and yellow, and they all mean different things, and we're going to talk about that towards the end of the course. Nothing to really get too concerned about right now, but at the end of the course you'll understand what they mean. Very simple to use, but it's nothing really to be too concerned about right now. Special reports. Suspected child or elder abuse. Remember, we are mandatory reporters. We suspect anything, child, elder, any kind of abuse on anyone or any kind of crime taking place. We are not to be the hero and try to make an arrest, but we are to notify our supervisors and report it. Possible infectious disease exposure. At this time of this video, we are dealing with the coronavirus, and if we are exposed by someone who is COVID positive, we are to notify our supervisors, and if we didn't know and our company finds out later, they are instructed to notify us. Injury to the EMS provider. If a patient punches you in the face and your company may pay for that by workman's compensation, but you do not put it in your patient care report, it therefore did not happen. So I know you might, say, well, he or she was not of their right mind and hit me, and it wasn't malicious, it was just, they were crazy, and you don't want to do anything about it. Well, that's fine. But in the future, if you have some kind of pre-existing condition because of it, and you're footing the medical bill, then your company could have been footing that medical bill, but you decided not to put it in your report, so therefore it didn't happen. So please document everything. It's not that you're being a snitch. It's just saying you're protecting yourself and your patient and your crew. Situations requiring additional documentation or notification of other agencies. All right, several formats for narrative documentation that are represented by mnemonics: SOAP, chart, and cheated. All right, so when you're writing your narrative, what this mnemonic is telling you is to put all subjective information, objective information, assessment, and then the plan. So that's in order of how you did your call. Here's a variation. Instead of so you're going to add 2 letters: intervention and evaluation. Chart, chief complaint, history, assessment, RX, and transport. My company, we use a chart: arrival, chief complaint, history, assessment, RX, and transport. Cheated, just another mnemonic. It's all pretty much the same stuff, just in a different order. It's really going to depend on your company. And if your company says you can use whatever you want to use, then you can use one of these. But if not, then they're probably going to have something for it that they want you to use. So, all right, case study conclusion. Rory was eventually called to testify at the trial of the accused perpetrator. Fortunately, because the case occurred a year after the call, Rory was able to rely on his thorough and accurate documentation to answer the attorney's questions about his observations of the scene and the patient's condition. The defense attorney questioned the meaning of the several of the abbreviations Rory used in the PCR. Because Rory always used standard accepted abbreviations, the defense attorney was unsuccessful in discrediting his documentation. Nonetheless, it is an experience Rory hopes he doesn't have to repeat. I will tell you this, testifying in court is very, very nerve-wracking. No matter how well you have it sealed up, still very nerve-wracking, because, let's just be honest, attorneys are not nice when they question, and they try to make you feel like crap, and it's not a very comfortable feeling. All right, lesson summary. PCR serves several purposes for the EMS system and emergency department. Good documentation should be accurate, concise, complete, and clear. Exercise cautiously in special reporting situations like where you're a mandatory reporter. Never falsify a report, and correct mistakes promptly. All right, that's it for Chapter 4. We'll see you next time.